Welcome to our special COVID-19 session number 30. This is the 30th session of our series, a special series that we have dedicated to diagnostics in the COVID-19 pandemic. Today, we continue with our current sub-series on antigen, SARS-CoV-2 antigen tests, rapid tests. We have talked about what these tests are. We've talked about the global launch. We have come to you with some of the manufacturers of these tests, and we shall continue to bring them as the weeks pass by. But in all these, what is important also to make sure that all of us get to know is, was this promised to be a game changer in our fight against the pandemic? How do countries get these test kits? We have talked about the pricing, that has been the pricing deals that have been reached out, but how do countries really get to access these tests? Hence, today we are going to be discussing about funding and procurement mechanisms that are currently available, that have been availed by various organizations and partners. This will be a 1 hour long session that we shall take a few brief introductory slides from our panel, a rich panel of presenters, after which we shall take questions and comments from you. Please enter your questions or comments into the chat box as the session progresses. Let me introduce our first speaker today, who's going to be Dr. Lara Vojnov. Dr. Lara is a diagnostic advisor in the HIV and hepatitis department, who is also currently supporting the COVID-19 response in the emergency department. So she will open for us today's session, and then we shall take various presenters that I will introduce as they come. Thank you. Over to you, Dr. Lara.
Great. Thanks, Anafi. And let me just try to share my slides again here, and hopefully you can see them okay. So I just wanted to actually, and I know we only have 3 to 5 minutes each, so I just wanted to take a quick step back about and really highlight what's been done over the last few months since the pandemic was effectively indicated earlier this year. Because it's really been an impressive group and team effort amongst a number of different procurement agents, as well as countries, partners, and whatnot. And it's moved in such a pace that I don't think we've seen this with any other disease, any other intervention at all. And so in the diagnostic space, we did have, luckily, was shared that the genetic sequencing as early as the 11th of January. Tests were developed fairly quickly, within a few weeks of that. And then actually the first PCR kits were sent out to countries and regions within a month of that genetic sequencing being shared. So quite a significant amount that's been done already since January. You can see we also have a number of products that are listed on the emergency use list, as that was only actually developed at the end of February. And really since then, in developing the Diagnostics Consortium, which I know we've spoken about already, as well as the ACT Accelerator, nearly 40 million tests have been procured. And this is simply across a number of procurement agents that work within the Diagnostics Consortium together. That's Global Fund, I know they'll be speaking today, GDF Stop TB, PAHO, UNDP, UNICEF, who's also here today, and WHO with nearly 30 million tests that have been delivered or are in transit. So quite an impressive team effort. And of course, there have been procurements directly by countries, by other procurement agents, but really quite a massive effort. Of course, we also know that there are some ways in which we need to improve amongst ourselves individually and whatnot in order to further support countries. When we start thinking about antigen-based RDTs, of course, one of the other key considerations that we want to perhaps be thinking about is how we might consider use of antigen rapid tests. And we have some recent guidance from our September 11th guidance that indicates some, at least, priorities for how we might want to think about antigen-based RDTs. And I know we've had this conversation in the previous webinar as well, would just point you there, because of course that's a really important consideration and thinking in terms of then forecasting and really thinking through the volumes as well as the funding that you might have available to procure some of these products, and how you may look to marry these tests with your molecular or PCR COVID tests as well, which is of course an important issue to then understand how you may want to move forward towards that procurement. And just highlighting on my last slide, and this is probably the most important one, is that though the price right now is about $5 per test, as has been discussed, we're hoping that this will come down over the next few months. On the left-hand side in the pie chart in particular are a number of different agencies. Of course, you can procure through the WHO and the supply portal, but the WHO really sees ourselves as the procurement agent of last resort, whether it's for countries perhaps that are struggling or don't have another procurement agent or struggle with procurement themselves, or in any other similar circumstances. But there, of course, and I know Global Fund and UNICEF in particular here are key procurement agents in the diagnostic space, and have those mechanisms in place to support countries. Like I said, there are some additional ones that we're working with, UNDP, GDF, PAHO, and I know that the Marketplace Group is going to speak as well today, and really just encouraging countries to utilize the procurement agencies that they're most comfortable with in order to try to access some of these tests that are now available. As indicated through an agreement recently, there should be about 20 million RDTs per month. And we're really trying to follow and carefully take a peek at the data as received by the procurement agents and by countries to understand whether or not an allocation framework might be necessary. Of course, it's about having funded demand and whether or not we have the amount of funds necessary to fulfill that agreement and fulfill the demands in countries. But we also want to ensure that no country is disadvantaged and no country receives tests perhaps at a later date or not at all because of procurements that are happening in bigger or wealthier countries. For any questions or concerns around diagnostics, around the procurement, the technical specifications, etc., I've indicated an email here to support on that, as well as some additional documents, including the emergency use list, which has a number of key supporting documents in terms of the public profiles, the public reports of those that are on the list, both on the antigen-based side as well as the molecular side, those that are currently in application and in review, which I think is worth reviewing as well, and our supply catalog, which again, countries, regardless as to the funding that's available, can submit requests within our supply portal. But again, I would also encourage going through any of the procurement channels of most interest. And I know Global Fund and UNICEF are here to speak to their pieces in particular. So with that, Anafi, I may just turn it back to you.
Thank you, Lara, for the introductory slides and remarks. As Lara mentioned, there are quite a number of organizations and procurement mechanisms that are becoming available. And today we are going to be having the Africa Medical Supplies Platform. We're also going to hear from the Global Fund, and we're also going to hear from UNICEF today. So to continue getting some introductory slides in terms of what exactly is in offer for us, let me call upon colleagues from the Global Fund, Martin and Aziz, to also just give us quickly what are the mechanisms that the Global Fund has put in place for the procurement as well as funding for SARS-CoV-2 antigen test. Martin, over to you.
So thank you, and thanks for the opportunity to talk today. I'm very impressed with over 300 people online. It's a good number of people. So in my few slides, I'm going to just articulate the Global Fund's role in making funding available, and also some, as Laura was saying, some procurement options, both with our grant funds, but also with our non-grant funds. Most of what I'm going to share are things from the website with the links so that you can actually look into the detail of the countries that you are in to see the precise numbers for yourself as I go through. I'm looking at how to do this page down. There we go. So for those of you who, I'm sure most people, if everyone knows about the Global Fund, but earlier this year, in response to the COVID pandemic, has made available $1 billion to its grants recipients across the world to shore up health systems and to mitigate the impact of COVID on the three diseases. And this is through two mechanisms, one called the C19RM Rapid Response Mechanism, which is additional funding. And then another way to access fund is what we call grant flexibilities, which is where we allow existing savings to be used for COVID type interventions. On our website, you can actually find on the link in the bottom left-hand corner an Excel file, which you see some extracts of, which shows the amount of funding that has been approved. So far we've approved just over $800 million to 120 countries. But one of the most interesting parts of it, I think, is the shot in the top right-hand corner, which per country breaks down the detail of that approval, including one column which will give the amount of the approved funding for COVID diagnostic tests. So for every single country, you can see what funding through the C19RM mechanism has been approved for diagnostic tests. This is not the remaining balance; it's the amount that was approved in the first instance. And just a quick slide showing the sort of things that the funding has been approved for. Right at the top of the list, you see procuring COVID-19 diagnostic tests along with PPE, as well as other interventions to support our programs. We see the provision of diagnostic tests and PPE as a key intervention, and around 60 to 70% of the funds that we've approved are to buy diagnostics and PPE materials. In terms of the supply of health products broadly in the COVID pandemic, we have a dedicated part of our website which is doing two things. First of all, what is the impact on the supply of normal health products, but then specifically how to access the different COVID interventions, whether that be diagnostics, PPE, oxygen, and hopefully very soon treatment. My last slide is digging into a little bit around around the diagnostics that are which are eligible for funding through the Global Fund, and how those tests, whether they be antigen RDTs or the PCR tests, can be accessed, as Laura was saying earlier. Our primary focus is making these tests available with the funds that we've approved through our grants. But we do have a pilot program where we can actually support the procurement using non-Global Fund money of the same products. And again, on this part of the website, this is all explained, and there are frequently asked questions on how to do things, documents. So I very much encourage you to, if you are interested to understand what funding have we approved in your country for diagnostics, and if you are involved in the decision making around procuring those products, these web pages provide you with some information on how to access them through the Global Fund channels. And that's where I will end.
Thank you very much. Okay, there was an echo. Thank you very much, Martin, for those introductory remarks. Colleagues, keep your questions coming through into the chat. We will be going into a Q&A after the introductory slides from the presenters. Next, I would like to call upon our colleague from the UNICEF, Lama Suleimani, to also give us what are the procurement mechanisms and opportunities that UNICEF has put in place to support this effort. Lama, over to you.
Thank you so much, and thanks again for the opportunity. This is, I think it's a great opportunity to explain also UNICEF procurement mechanism. I will quickly present to you UNICEF procurement for COVID diagnostic tests, which includes also the antigen RDTs, and as well the procurement mechanism that you can utilize to procure the test in general. To date, supply division, we procured COVID diagnostics actually for 63 program countries from 12 diagnostics manufacturers for about more than $45 million. And this includes diagnostic test kits, extraction kits, sample collection kits, and of course we have started, as Lara and Martin mentioned, with the molecular diagnostic test kits, as mentioned here in the slides and the figures. This is just a map to show you actually the countries that we have reached out to and delivered the test kits to date. These are the top 20 receiving countries, starting from Nigeria, India, and so forth, as you can see on the right side. On the left side, this is the COVID diagnostics, UNICEF COVID diagnostics procurement by region, and of course, 34% of it is for West Africa, and followed by East and Central Africa. The range of diagnostics, as I said, molecular tests from manual to automated under the diagnostics consortium. And also we have the serological tests that are WHO-EUL status, have the WHO-EUL status, the two rapid diagnostics standard Q from SD Biosensor and Bamboo from Abbott. The information is mentioned on the slide, but I will also take you through where you can find this information on our UNICEF supply catalog. We have, this is the link, supplyunicef.org, and actually we have designed a landing page where you can see the more information about the new molecular and the new serological assays, where you can click and download the technical information about and the commercial information about each of those products. So this is a highlight of the molecular where you can select the product and download the report. And this is actually the newly introduced serological assays where you can select the product and also download all the related commercial and technical information. So in general, governments and development partners using their own or other mobilized resources from development bank financing should continue to use UNICEF Procurement Services ordering channel. And actually, if you receive the slides, you will see the link to the UNICEF Procurement Services on our website, but I will take a few minutes to explain to you, if you did not use it before, the mechanism. Governments also should contact our local UNICEF country offices to submit the request, the official request, through our PS. And development partners also can reach out to the email address mentioned on the slide directly to initiate the process. Quickly, I will not take a lot, but I will just explain that, of course, UNICEF has two mechanisms, either the program supplies or the procurement services partner funding. And this is where I will focus now to access any procurement. So our procurement services as well is a non-profit, and the costs are recovered through handling fees. You will see on the website a range of handling fees based upon economic of scales and a percentage of the unit prices. But however, for COVID diagnostics, we have actually set the handling fees as 4% for low developed countries and 4.5% for non-developed countries. Minimum, of course, there is also a contingency buffer that we include in our procurement just to cater for any changes or exchange in fluctuations, and unused balance will be returned, of course, to the partners when concluded. Our partners or our main partners, governments, international development agencies, other UN agencies, non-governmental, as you can see here. The process starts with signing a Memorandum of Understanding, which outlines actually our procurement services process and sets out the terms and conditions for individual transactions. We start by you requesting a cost estimate from UNICEF. As I have explained, there is a form that you need to fill in where you will, for example, for antigen RDTs, you will specify the product that you need and the delivery schedule and the quantities. This is a snap of how the form looks like, and this is what you need to fill in. And of course, the form will explain who is the requester, what supplies exactly, and where you want them to be delivered and when. Then we will respond back to you with a cost estimate, which will outline the cost of goods, the handling fees, the freight and insurance, the contingency buffer. All details will be included in what we call a cost estimate. It's a kind of a quotation, more or less. Once you accept the cost estimate and deposit the funds, then we actually, upon receipt of funds, then the supply division can start the procurement activities, and the deliveries will be according to the agreed terms. Then it's the normal account settlement and the invoices, and the remaining contingency buffer will be returned to the partner's instructions. All the details are mentioned on our website. If you log into the website, you will see the details and you will see how to access it. But as I mentioned, it will be really great if you get into contact with our local country offices in countries, and they can take you through the process. I will stop here. Thank you so much.
Lama, thank you very much for that overview from UNICEF. Lama is the contracts manager from UNICEF at the supply division. Next, I would like to call upon Chidima Ifepe, who is the head of buyer management at the Africa Medical Supplies Platform, to also give us a similar overview from a perspective. Chidima, over to you.
Thank you very much. Good afternoon once again. On the African Medical Supplies Platform, I'd just like to talk about two major structures we have in place to support the antigen RDT procurement. So for us, because we are a digital platform that was launched in June as an emergency response for the African continent, what we've tried to do is try to digitalize the tendering process on the continent. So I'd like to explain the steps you can take to access our procurement services. So for us on the African Medical Supplies Platform, access to the platform for you to make an order or to you need to have actual credentials to the platform. Because this is a closed marketplace, we do some level of vetting and KYC verification for each buying entity before we provide these credentials to buyers. Again, I'd just like to stop and note that because the platform it was an emergency response, we are currently catering to African Union member states, certain authorized foundations, big farmers, and CARICOM member states. So if you want to access, whether it's the biosensor or the Abbott Pan-Biotest or Lumira DX antigen RDT on the platform, you will there are 5 basic steps that you need to take. One of the steps is, you just come onto the platform and you go through the supply catalog or the list of items we have on the platform. So after reviewing the product description and the different specifications, next step will be for you to place an order. It's pretty much like your regular e-commerce user experience. So you click on an order, you decide to add it to your cart, and you go on to checkout. The experience is pretty similar. So once you've decided that the item you want to purchase on the platform, you're going to have to make payments for those items. Once payment is received by us, the seller is going to prepare the shipment before we commence processing. This five-step procurement, this five-step process has some sub-steps. So what I've presented here is just a high-level framework on how the procurement services or the procurement setup to acquire SARS-CoV-2 Antigen RTD will work, right? So once you already indicate interest, or once a government entity indicates interest, I've already mentioned there's some certain verification and KYC process that will go into your applications. This for us is just to validate that whoever is requesting this product, they are requesting it and they have been authorized to access the platform for this product. So that was really that was just an introduction into what the digital marketplace is offering to the continent. But to really speak to what we are doing in relation to the antigen procurement, we have multiple partnerships that are currently ongoing. For example, we have in the works a partnership conversation that will distribute Lumira DX antigen test to the AU member states. This is still the fine details, the fine prints are still in the work, but this is an announcement that will be coming in the next couple of days or at most the next couple of weeks, because we've also seen the increase in interest and the direction that the African CDC has noted for the African Union member states. We've noticed much more interest in antigen tests. So our response is to work with partners like the Global Fund through their Global Fund Consortium medium to get access to these critical products. On our own side, we've also formed strong relationships, and we're continuously forming strong relationship and communication channels directly with the manufacturers, so that in the event where we need to start looking at an allocation model as is in place with PCR tests, we can already start planning with the different countries and the different entities if it gets to a point where we need to be distributing based on an allocation system. So I already mentioned that where we are supporting the continent or for antigen procurement is really true strategy, because we get a lot of feedback around different entities in different countries access critical funds to purchase these products. So outside of organizations like the Gates Foundation and the MasterCard, the Lumira DX antigen program, we also have facilities, and different credit funding for government and approved buying and access of these much needed products. So what we do once
it looks like we lost Chidima. Looks like the internet is a bit of a challenge. Hopefully she rejoins soon. But I think she was at the end of her presentation.
Yes, thank you.
Hello, Chidima.
Yes, thank you. Sorry, we are dealing with network issues.
Yes, I noted that. But I'm glad you are back. We can hear you now, but you were towards the end. We lost a bit of a few remarks that you were making maybe in the last 15 or so seconds, if you want to just clear it.
So I was just doing a recap, right? So for the COVID antigen RDT procurement mechanism, for buying entities that are interested in accessing this product, what we're also going to be doing for them is working in an advisory capacity. If like for programs where we are actively involved, we will advise those entities of what's coming to them. For example, with the Libera DX program that is currently in the works, we are advising entities on what entities that are interested in accessing funds, not necessarily grant, introduction and conversations with Afri-Exim Bank, which these are the founding, and these have been doing with government entities. They have been providing facilities to these entities to cover their procurement costs over this COVID period for critical medical supplies. So I think that just to kind of talk, if we're talking about what the African Medical Supply Platform is doing to assist the continent access these critical supplies, I would say this is what we have done and this is what we've been doing. And that's where. Thank you so much.
Thank you very much, Chidima. We at least managed to get you clearly towards the end. So now, colleagues, it's time for questions and comments. Please keep them coming through the chat box. If possible, post to everyone so that we don't miss some of the questions. So I'll take some that came. I think the first one came from Maruping from Botswana. So Maruping says, I note different agencies through which procurement of antigen RTTs can be done. Is there an advantage with regards to price and also a lead time if one procures through these agencies? I think he's asking what is the advantage of doing it through any of these agencies rather than doing it individually? Maybe let me just ask Lara to take that first.
Yeah, should I come in on that? I think it's really, we're encouraging countries to perhaps go with the agency that they feel most comfortable with, that they would like to rely on. It partly depends on the funding that each of the different countries have. If you're using Global Fund funding, of course, you maybe prefer going through Global Fund. If, for other reasons, you may go with a different procurement agent. I think at this point for antigen RDTs, ideally the lead time should be similar across the different agencies, across the different products. So right now, for the majority, all of us, I think primarily, or at least those of us within the Diagnostics Consortium are primarily focused on those products that are on the emergency use list. I know there was another question about some of the other products, and I think we're following closely those assessments from the emergency use list to see if any additional products should be considered. But within the Gates agreement, it's our understanding that once a purchase order is issued, the lead time should be about 15 days, and that's regardless as to which of the different agencies those countries go with. Martin and Lama may have additional comments on this, but I think, ideally it's as the countries are interested in their preferences and perhaps who they're most comfortable working with from previous procurements, as well as, it's just open for country decisions at that point. I'm not sure I can say that any one is better than another at this stage.
Thank you, Lara, for taking the first cut. And you also talked about the lead times. Martin, Lama, and Chidima, any comments around lead times? Martin?
Thank you. So, like Lara said, the lead times are the same. I think the the answer to the question is are there any constraints on the procurement route through the funding? And then secondly, what is the one that works best for the country? At the moment, the Global Fund is centralizing the procurement, whilst in the first few months of the product availability, just to optimize the supply. And we expect as more products become available beyond the two that we are financing at the moment, that multiple procurement channels will open up for Global Fund financing.
Thanks a lot, Martin. Lama, you want to add anything?
Thank you. No, actually, nothing to add. It's as Lara and Martin mentioned, the lead times are the same from the suppliers, but it's up to the countries actually to pick or to choose the appropriate funding or procurement mechanism that they want to utilize. Thank you.
Thank you. Chidima, you want to add anything?
No, nothing.
All right. Thanks.
Thank you.
Moving forward, there is also a question. This one is directed. I know Lara tried to touch a bit on it as she answered the first question. The Global Fund. This is from Tobias David. The Global Fund has only SD biosensor and Abbott PanBio, two of the test kits that we have already presented on this platform. So he says, why is it you only have SD biosensor and Abbott PanBio in your portfolio? Why not now check Bionet? What about BD? I'm sure he's asking, are you intending to expand this list?
So I'll start and perhaps ask Lara or others to support me, because I'm not a lab expert. For procurement through the Global Fund, we have two requirements. First one is that it meets the QA standards, and you will find those two products that were mentioned listed as meeting our QA standards. The second proviso is that the product is meeting the, should we say, the clinical indications recommended by WHO, and I believe that is why looking at those two criteria together, that you end up with the SD biosensor and the Abbott product at this stage.
Thank you very much, Martin, for that. So there you go. You have it, Tobias. I think Global Fund has its own requirements, and he has just outlined them. And just also to recap, what I wanted to recap on the first question was, while the mechanisms are there, I think what will also be important is to see which ones are eligible for you as a country. Moving on to the next question, and this one, I'm trying to see where did it come from. I didn't pick that correctly, but he or she is saying, will UNICEF handle registration with country FDAs and get import permits, customs, and waivers? I think it's all about the logistics of getting the product to where it's required. Alama.
Yeah, thank you. Yeah, I saw the question. Now, UNICEF, when we actually offer the products on our cost estimates that I have mentioned, we offer them on CIP Incoterms. So meaning that we deliver the goods up to the port of entry, and then the partner is responsible for the custom clearance. The partner is responsible for the waiver of any customs and clearing the goods at the port of entry. So this is the Incoterm that we use. Now, if additional services is required in country, like in-country logistics, like clearance, like whatever is additional on the CIP Incoterm, then this is why you need to get in contact with UNICEF country office, and they can support in that aspect. Thank you.
Thank you. Whilst you are there, Lama, before you drop, there is a question that came from Elizabeth Kampira, and she says, please share the UNICEF catalog. Very difficult to go through it. Any remarks?
Yeah, I don't think it's difficult, but I can, of course, the link is there. And if you go to the link directly, I've even in the presentation, you could see the landing page of the supply catalog. Then you can go to the products, and we have categories. It's, for example, for COVID diagnostics, we have created a category for COVID diagnostics. And once you click there, you can see all the items. You can also use the search. So I don't know how to do it, Anafi. Maybe I can share with you the link, and we can give more guidance into that.
Certainly.
I'm happy also to take bilaterally, yeah.
Yes, thanks, Lama. That would be a great way of doing it. You can share with us the link, and we can share as we share the slides as well as the recording for this session. Moving on, and I think this is applicable to all the procurement agents here present. This is from Stanley Bulime, and Stanley says, what's the plan by UNICEF and Global Fund to engage the private sector in SARS-CoV-2 supply chain? And I think it also applies to the Africa Medical Supplies Platform. Is there any plans to engage the private sector, or is it already existent? Maybe Martin, you want to start? Yeah. Okay, you can start, Chidima.
Yes, thank you. So on the African Medical Supplies Platform, we received the mandate to expand the customer base to the private sector. So these are approved large hospitals and farms in each country. And we have been engaging with them in the last couple of weeks. So in response to this question, I think engagement has already commenced with the private sector. There's obviously a lot of work that needs to still go in. I mean, there's lots of talks around, what's the mechanism for mass clearance, registration with the regulatory bodies in country, and these are a few other topics. And I mean, these are conversations that they've been raised on a Pan-African level. And I know for a fact that we are working with the African Medical Agency and just specific countries, regulatory bodies to define like how we will start massively registering products across the continent. I don't see all of the questions raised being answered in the near future, but we've been discussing workarounds, and these and more will be shared as as time goes by on the platform. I mean, that's what I can share from the African Medical Supplies team.
Thanks a lot, Chidima, for those insights. This is a very important question indeed in terms of the private sector. Just for an example, quite a number of airlines actually sort of recognize maybe some of the results that are coming from the private sector. The question is, will they be able to cope with the demand? Any sentiments there, Lama? Have you any plans to engage the private sector, or are they already existent?
Thank you, Nafi. No, actually, now we are not engaging with the private sector as such. I don't think that we have the plans now, but it's something that we are actually considering more or less. But if I can answer now, no, we don't have any plans. Thank you.
All right. Martin, you want to?
I mean, similar to UNICEF, I mean, our prime counterparts are government and non-governmental organizations in the countries which we work. If a government delivers their services through a private contractor indirectly, we may supply, but we're working primarily with governments and with NGOs, both on the funding side, but also on the supply side as well.
Thank you. So there you have it. So currently, there is not a straightforward mechanism. The Africa Medical Supplies Forum is working on it. But currently, procurement mechanisms that are there are dealing with governments, and we know certain governments have already some arrangements with their own private sector counterparts within the country. I want to turn over to Lara, and I know with your role within the WHO and the Diagnostics Consortium, maybe you can start with this question from Haley Benty, who says, as demand for SARS-CoV-2 antigen rapid testing is so high, is there a limitation for purchase in case enough funding is available? But I think, I'm not so sure I understand, but I think the question is there a cap on how many one should order, and the need to equitably distribute this?
Yeah, thanks, Anafi. So that's a great question. And I may actually just touch on the private sector piece a little bit as well, if you don't mind. As Martin and Lama said, primarily we are supporting ministries of health and NGOs where and if possible. For those products within the Diagnostics Consortium, at least, that are not constrained, so we have effectively unlimited supplies. Those are typically manual tests and sample collection kits. For WHO, anyone can put those into the supply portal, that type of a request for those products, and receive them. So that includes high-income countries, so any of our member states. That includes also those in the private sector, et cetera. So there is the opportunity to procure some of the tests in that way. For allocations, primarily right now, we are focused on providing equitable allocations for those tests that are constrained. Right now, we see that as being those from the molecular side for Abbott, Cepheid, and Roche. And so I know a lot of countries, we have a significant demand, particularly for Cepheid, above the availability. And unfortunately are having to conduct equitable allocations. And so most countries are unlikely to be able to receive the volumes that they have funding for and that they're requesting. But we're trying to work together with some of those manufacturers to increase those allocations. For these 2 antigen-based RDT products, it looks like we should have about 20 million tests per month for the next 6 months. At this point, we've seen funded demand of about 11 million tests for October, which means that there's still some leftovers in case countries want to procure additional tests. We're following this closely and working with the suppliers, working with Gates and Chai within the agreement to understand whether or not the funded demand will exceed the availability for the month or not. If it does, like the question suggests, exceed the availability, then we will quickly move forward towards trying to conduct an equitable allocation to make sure that all countries can receive at least some products. But at least right now in the early stages, we haven't seen that yet happen. And so we're still hoping that this will be a relatively open and free market.
Thank you, Lara, for those remarks and responses as well. Just want to also appreciate Wandani and Fatim in the chat. Thanks a lot for providing the links to the Global Fund as well as to the UNICEF pages that supply the important information and also some of the answers to the questions that are being asked here. Lara, I just want to come back to, I know we're talking about SARS-CoV-2 antigens here, antigen rapid tests, but this question also, I think, touches on the equitable distribution, and used Cepheid as an example. And Mr. Joseph from Malawi, Joseph Petilinyu, says, UNICEF, we are indeed in need of GeneXpert cartridges, but the country cannot get them. What should we do? I think that's exactly how he has put it.
So that's a good question, and we probably answer this question almost on a daily basis at this stage. And like I said, I think we'd love to have access to any additional tests and products from Cepheid and others to meet some of the demands, but unfortunately the country demands, particularly for that product, are significantly high and much higher than what we see for some of the other products. You know, it is supportive in the sense of being able to be used a little bit more decentralized. So we would suggest, if you're not able, hopefully you've been able to go through Global Fund, UNICEF, you know, UNDP, WHO, whomever, to access the allocation that you do have, those minimum volumes. If you need more, you know, one of the potential solutions is to think through your testing strategy and whether another product could fulfill your testing needs until additional diagnostics and tests are available from that particular supplier. At this stage, we're hoping that we may see more available. Of course, there are issues with the pandemic increasing again in Western Europe and the US, and so the availability to LMICs remains relatively smaller compared to the high-income countries, and we just need to start thinking through how we can create a testing strategy that works and that your needs are being met.
Great. Thank you once again. I think I need to move on to this question. I think it might have been Lama who mentioned that we work with partners in country. So maybe this is where this is going. This is from Toyosi Rahim, and he or she says, are there any vendors for SARS-CoV-2 diagnostic kits that can be recommended to professionals in our region? Unfortunately, she didn't mention which region that is, and then mentioned the issues of in-country regulatory requirements. Do you suggest such, what in-country regulatory requirements do you suggest to such vendors to comply with? I think it's an open question whether there are any certain specific vendors or groups that are already having arrangements with any of these procurement mechanisms in any region. Who should I start with? Maybe let me start with Lama.
I'm sorry, Anafi, can you repeat the question? I didn't get it here.
Yes, I hope I interpreted it correctly. So Toyosi is asking whether there are any vendors of these diagnostic kits that can be recommended in his or her region. Unfortunately, this is the region hasn't been specified.
Okay, but regardless of the region, actually, I'm sure same like the Global Fund and other agencies as well, we follow quality assurance policy, and then one of our criteria is the product needs to be listed by WHO UL. So it's a product, actually, it's not the vendor. So the product, if it's listed by WHO UL, and of course Lara can speak better than me on this, then it's from the manufacturer. So then the manufacturer or the manufacturing facility has been actually approved for that particular kit. So we are restricted with whatever was approved as a regulatory pathway here, more or less. And this is how we offer it to countries. I hope I have clarified it. Thank you.
Okay, thank you. I think you have, it's not about the vendor, it's about the issues of quality as well. I know we are almost reaching the hour, and I think it is important for us not to leave this question that I'm about to ask, and it's been asked by Dumile Sibanze from Eswatini, the Kingdom of Eswatini. Whilst it's not directly related, whilst not directly on antigen RDT, but many a time we've talked about SARS-CoV-2, the issues of safety come into play. And she's talking about some of the constrained supplies are N95 masks. And what is your take on this? And I'd like to thank Chidima, who has also provided, I think, specific details and an email on how they can reach out to the Africa Medical Supplies platform. And then they also have the ability, she says, we have received renewed interest, and they can help you as countries, I know, Dumile and team, to plan for supplies for N95 masks. So thanks a lot, Chidima, for that. I don't know, from the Global Fund and also UNICEF perspective, and maybe Lara, you can come through here, as countries and agencies place these orders. Is it strictly RDTs, or the issues of safety are also inclusive?
So for the Global Fund, I mean, we see the two key interventions where we have a rollout to finance diagnostics and PPE. We're funding about in equal quantities in dollar value. maintain the programs.
Thank you for that. And Lama, I assume it should be the same with UNICEF as well.
Yeah, of course. UNICEF also supplies PPE, and if you go through the catalog, you can find a range of items actually currently available on our supply catalog.
Thanks a lot, Lama. I want to come back to Lara. You know, time is always, they say time is one of the fairest things on earth. It waits for no man, even for a king, and it has not waited for us. So we are now reaching the end of the session. So Lara, in 30 seconds, what sort of few words that you can give to the audience as we try to part here?
So I think the biggest thing, and just touching on the PPE issue, I think we have seen that market open up quite considerably. So there are some availability of N95 masks. I think the only restrictions are around the medical gloves at this stage. But really, it's just, you know, please send along questions to ourselves, to Global Fund, to UNICEF, to the procurement agent with which you usually work. And hopefully we're all fairly coordinated on a global level and sharing information regularly. And so we'll, you know, if we can't, as WHO, answer a question that you have or provide the support in a certain way, we'll do our very best to link with Global Fund, with UNICEF or whomever to do so and to try to move forward and support your supply needs as quickly as possible. So please feel free to reach out. I think the slides we can share, and there is an email list there with which you can do so. And we're hopeful that, you know, amongst ourselves as a collective group and as a consortium can really support countries as best as possible. Thanks.
Thank you, Lara. Martin, any parting words in 30 seconds?
Lara said it all. Thank you.
Thanks, Martin. Lama.
Thank you so much. But yeah, I agree with Lara and Martin. Lara, she mentioned it all, and we are here ready to support. Thank you.
Thank you, Lama. And Chidima.
Thanks. I really don't have any other things to add. It's all of us are fighting the same pandemic. So send an email. Everybody's here to support the procurement needs.
Thank you all, and I would like to thank all the presenters today for the very informative session. I hope we have all benefited one thing or two, and we shall be sharing the slides as well as all those resources and links that have been shared in the chat. Please keep your questions coming through and we will forward them to the rightful places. And I also want to thank all of you who have come through in numbers as usual and made this session also quite helpful by asking questions that are pertinent to our fight to win this pandemic. On your screen now, I'm going to be sharing information for those that require any documentation as to having spent the last hour with us, having also benefited in the discussion. You can go to the ASLM Academy page and download. We acknowledge some of the challenges that you will face through, but feel free to visit our frequently asked questions section to answer some of the key questions and challenges that you may face. But should you not be able to get any solution, feel free to send an email to us and our team will be able to help you. Till we meet again, good afternoon, good evening, and good morning to some of you. Thank you.
Thanks, Nafi. Great session.